British Prime Minister Boris Johnson said Wednesday that COVID-19 vaccines are proving effective against a variant that has spread like wildfire in India, and denied the government was being lax on travel from hotspots. Johnson has said had been under pressure for delaying restrictions on travel to and from India last month, at a time when he was still planning to head to a trade-focused summit in New Delhi. The trip was eventually called off as India succumbed to a devastating new wave of infections, and it was then quickly added to the UK's red list, meaning arrivals have to quarantine in hotels at their own cost. But more than 100 flights have landed from India since then, and the variant has been spreading in Britain, especially in areas with large South Asian communities, potentially endangering plans to reopen the economy fully from June 21. Here is UK's Health Secretary Matt Hancock with some travel advice.
That you should not go to an amber or red list country on holiday. You should only go in exceptional circumstances. You asked for examples. An example might be to visit a very ill family member, or to go to a funeral of somebody who is very close to you. They're two reasonable examples. And I think we have been really clear through this pandemic that there are some things that we have banned in law, but there are some things that we do not recommend.
The Health Secretary, meanwhile, is facing calls to explain his claim that the rise of the Indian variant in Britain is due to a refusal by some people to get vaccinated. Announcing surge testing in several more areas, he said the race between the virus and the vaccine has got a whole lot closer. On Wednesday, Britain recorded another 2,696 cases of COVID-19 and 3 more deaths, taking the total to 127,694, one of the world's worst tolls.